Type 2 diabetes is a prevalent condition that arises when the body's ability to regulate glucose or sugar and use it for energy becomes impaired. This long-term condition is characterized by excessively high levels of sugar in the blood, which can ultimately disrupt the circulatory, nervous, and immune systems. In type 2 diabetes, two main issues occur. The pancreas doesn't produce enough insulin, a hormone essential for moving sugar into cells, and the cells themselves don't respond properly to insulin, leading to reduced sugar absorption. While type 2 diabetes typically begins in adults, it can also start in younger individuals. The rise in obesity rates among children has led to an increased incidence of type 2 diabetes in this group, although it remains more common in older adults. There is currently no cure for type 2 diabetes, but it can be managed with lifestyle changes. Losing weight, following a healthy diet, and exercising regularly can significantly help control blood sugar levels. When lifestyle modifications are insufficient, medication or insulin therapy may be necessary. Type 2 diabetes is a condition where the body's insulin production is insufficient, or the body's response to insulin is impaired, leading to insulin resistance and glucose accumulation in the blood. In children, type 2 diabetes develops gradually, making its symptoms hard to detect early. It's often linked to being overweight and having high blood sugar. Early diagnosis and treatment are crucial to prevent complications. Lifestyle changes like healthy eating, exercise, and weight loss are key in managing the disease. Regarding pregnancy, women with type 2 diabetes can have healthy pregnancies by managing risks. This includes controlling weight, diet, and any conditions like PCOS. Some women might control diabetes through lifestyle adjustments, while others may need medication. Consulting with a healthcare provider is vital for safe medication use during pregnancy. In a healthy body, energy comes from glucose, a sugar derived from food. This glucose circulates in the bloodstream until insulin, a hormone produced by the pancreas, helps it enter cells, providing energy. In type 2 diabetes, insulin is present, but the body's cells resist its effects. This insulin resistance causes glucose to build up in the blood, leading to high blood sugar levels. Several factors contribute to type 2 diabetes. The body's resistance to insulin, insufficient insulin secretion by the pancreas, excessive glucagon release, obesity, lack of physical activity, and genetic predispositions are primary causes. Risk factors include family history of type 2 diabetes, prediabetes, obesity, heart disease, hypertension, low good cholesterol levels, and conditions like PCOS. Older adults, especially those over 45, are more susceptible. Gestational diabetes during pregnancy also increases risk. Obesity and lack of physical activity are significant contributors to type 2 diabetes. Excess body fat, particularly around the abdomen, can increase insulin resistance. Physical inactivity further exacerbates this risk. Genetic factors also play a role, with a family history of diabetes increasing one's chances of developing the condition. Additionally, conditions like heart disease, hypertension, and low good cholesterol levels can elevate the risk. Women with polycystic ovary syndrome, PCOS, or those who have experienced gestational diabetes during pregnancy are also at higher risk. Age is another factor, with individuals over 45 being more prone to type 2 diabetes. Type 2 diabetes is a chronic condition that affects how your body processes glucose. It often shows no symptoms in its early stages, making it hard to detect. However, some common symptoms include frequent urination, excessive thirst, and an increased appetite. People may also experience unexplained weight loss, blurred vision, numbness in the lower extremities, and frequent infections. Fatigue, dry mouth, and headaches can also be indicators. Diagnosing type 2 diabetes involves several tests. The A1C test measures average blood sugar levels over a few months, with levels above 6.5% indicating diabetes. A random blood glucose test showing levels above 200 mg per deciliter or a fasting glucose test with levels above 126 mg per deciliter confirm the condition. An oral glucose tolerance test, where glucose is measured 2 hours after consuming a sugary drink, can also diagnose diabetes if levels exceed 200 mg per deciliter. Urine tests may reveal ketone bodies. Complications from type 2 diabetes include heart disease, neuropathy, and nephropathy. Eye diseases like diabetic retinopathy, foot gangrene, and osteoporosis are also risks. Bacterial or fungal infections, hearing disorders, and even Alzheimer's disease can occur. Therefore, it is crucial to manage diabetes effectively to avoid these complications. Preventing type 2 diabetes involves lifestyle changes such as adhering to a healthy diet low in fat and calories. Regular physical activity, like 30 minutes of exercise daily, can help. Maintaining a healthy weight is also crucial in preventing obesity and, subsequently, type 2 diabetes. Type 2 diabetes is a chronic condition that affects the way the body processes blood sugar, glucose. Effective management of this condition requires a multifaceted approach. Diet plays a crucial role in managing diabetes. It's recommended to follow a diet rich in vegetables, fruits, and healthy fats, while minimizing sugars and unhealthy fats to prevent hyperglycemia. Ensuring regular meals is key, as going without food for more than 3 hours can lead to low blood sugar levels. Maintaining a balanced diet is essential. In advanced cases, insulin replacement therapy may be necessary. Moreover, controlling blood glucose levels through medication and regular exercise is vital. Medications for type 2 diabetes include metformin, tulazimide, gliclazide, and miglitol, which help in managing blood sugar levels effectively.